Whatever happened to keeping a patient under observation and only sending them home if their condition has improved?
There was one specific doctor at Lionsgate who failed to do his job.
The College of Physicians and Surgeons of BC found that didn't happen on Natasha's third visit to the emergency at Lionsgate Hospital before the 29-year-old died of toxic shock syndrome on October 12, 2020.
Why, in her third visit, was she being sent home with no diagnosis?
Even with the college committee's criticism of one ER doctor for inadequate assessment and documentation of vital signs on discharge, Forry's mother says there's no accountability.
It's absolute garbage. There's no other way to put it.
In a final letter to Forry, the college writes the doctor attended for an interview with registrar staff to discuss the issues raised by your complaint. This satisfies the recommendation made by the inquiry committee in its conclusion of the complaint.
And I can only presume they said, next time a patient comes in after the second visit, don't send them home to die.
Forry says this is further proof a medical review process often touted by government as a path forward towards answers and accountability is not there to help patients or their families.
I'm absolutely disgusted with the whole process. And so, was it worth it?
This grieving mother says what makes matters worse, the doctor in question first tried to appeal the decision but was denied.
A total slap in the face. Not only did this doctor not take responsibility, he tried to avoid any accountability.
That's renewing calls for the province to reform BC's wrongful death legislation, which currently limits the ability to sue for damages.
They would think of retraining their staff, making sure that the proper procedures are in place.
Attorney General David Eby committing to reviewing the legislation by the end of this term. But families say they've been waiting on that promise for more than a year, with little sign of progress.
Where are they held accountable? Where's everyone's health and safety put first?
Global News asked the college why no further action was taken, but we're told its investigations are protected under privacy law. It's important to note only matters that go before a disciplinary hearing are made public. But a doctor has the ability to avoid taking it that far. John Hua, Global News.